Naeem, drop a text to your class group and ask them to join.
Yes, ma'am. Yes. Ma'am, some of our legal parts were incomplete from the syllabus.
Okay.
So will Ningthem sir, will he continue or
Okay, I don't know whether he's gonna continue or not. I'll just talk to him. What are the topics which is not been completed?
ma'am, I have to check that.
Okay, so do one thing. In the evening or tomorrow, just tell me what are the parts which is not been completed. I'll just talk to him. In case if he's telling that he will not be able to take or something like that, then I'm gonna take that.
Okay, ma'am. I'll let you know.
Okay, okay, all right. Anyway, I'm not that much thorough with legal part, but still I can just have a read and then discuss about all these things with you people. So if in case he is not able to take those classes, I'll take.
Okay, ma'am. Okay, ma'am.
Yeah, okay. So do let me know. Okay, discuss among yourself and then let me know what are the topics which is not been completed yet. Okay.
Okay, ma'am. Okay.
Yeah. Naeem, did you discuss with your sir regarding that study?
Ma'am, no, actually, I was developing this LR part,
Hmm.
so I did not actually think about the methodology yet. So once I confirm with that part, then I will ask him once.
Yeah, okay. What about Nawaz? What is happening with your project? Nawaz, how is your project going on?
Literature review I have done.
Okay, so that is approved.
Yes, ma'am.
Okay, who is your mentor?
Bhavajyoti Shaikya, sir.
Okay, I don't know who is he because I didn't even see whole department yet. So I don't know. Yeah, tell other people to come join. No, it's so disappointing that I have to wait for this much time and then nobody joins. Like yesterday, also only two people were there. It's like batch by batch, or what you people decide that okay, this batch today will go and then next batch will be going and joining.
No, ma'am, I had to go to our place yesterday. My relatives came, so
No, I know about you. You used to be a regular. So I'm just talking about other people. I don't, I don't feel good like this. If there is not much students, there is no
Ma'am,
point of
I-
teaching.
ma'am, I'm informing them. I'll scold them in our group.
You'll scold them.
Yes, ma'am, I'll scold them.
Joydeep has to be the one who had to scold. He only used to disappear.
Ma'am, he's very he's a good boy, so he's he doesn't speak much.
No, he is CR, right? He has to come first and call others later on. Like this is what we did. The CR used to always call us, and then only we used to go for classes. So CR's responsibility is to get those students anyway in the class. Even sometimes this CR used to trick us, saying that, you people will be, what to say, getting really good marks. I'll talk to sir, and then if you attend sir's classes, then you people will be getting really good mark. I will talk about it to sir. It seems. And sometimes he used to tell us that we'll ask the question, and then he's gonna answer. I mean, like he's gonna give us the question pattern, how he's gonna conduct the exam. So attend the classes, okay? But we never used to get those.
Yes.
Oh,
I was
so what?
I was CR in during my graduation for one semester, and then the teacher said no, thank you in the next semester. Like I myself wasn't there in the class and all.
Okay. Yeah, I understand. You have to trick those people and then let them come to the class. I know classes are not good. I mean, I don't believe in classes only. So, but then, it don't feel good when you don't have many students. Now I'm feeling the pain, that if there is no students in the class, how does it feel?
Yes, ma'am.
Nivedita is there, Naim is there, Nawaz is there. Where else the other people are? It is 10:22. I wanted to ask you people, how do you people like how other professor used to take the classes? Does they ask you to open your videos? I mean, like ask you to put your camera on?
Yeah.
No, ma'am.
Okay, so
No, ma'am.
it's like this only.
Yes,
Yes,
ma'am. Like this
ma'am.
only.
Okay. Should I be a little bit strict saying that if you people don't come to the classes for next 1 week, I'm not gonna give you attendance?
Yes, ma'am. You can try.
Should I be a little bit strict?
Yes, ma'am. Yes, ma'am. You can try that one.
Okay, let me try. I didn't have to.
I think everyone is taking lightly.
Uh,
Ma'am, how is the PhD scenario in downtown?
that is what I am also trying to figure out. Once I figure out, I'll let you know because I'm also planning for it. So,
Okay.
I mean, like if in case anything I get to know, I'll tell you the process how it is being done over here.
Yes, ma'am. I think they will start their batch from January or so. This batch.
This, I mean, like this year, they have closed it. I think the last date was 20.
Yes, ma'am. 20th December.
Yeah. See, I have written now. I feel scared to be strict also. Okay. So, all N's are there. See the pattern Naeem, Nawaz, Nivedita.
Yes, ma'am.
So morning I was seeing a post, so I thought of sharing this one with you people. Okay, so the post is like this, starting with two stories. Yahoo refused Google, right? And Nokia refused Android. So moral of the story is that update yourself with time, else you will become obsolete. And taking no risk is the biggest risk. Take risk and adopt new technologies. Isn't it? Isn't it right? That Yahoo refused to Google and now it is completely disappeared from the market. Nokia thought of being the number one, what is that company for mobile, but it just got what to say, disappeared in the market because people choose to use Android phone rather than using Microsoft, isn't it?
Yes, ma'am.
Yeah,
They got
then
outdated.
yeah, they are outdated now. And two another stories are that Google acquired YouTube and Android. Facebook acquired Instagram and WhatsApp. Though Facebook is not much popular nowadays, but still because it is like it has also acquired Instagram and WhatsApp, people are still believing in Facebook, and they and this other two apps are also being used very much, isn't it? So moral of the story is that become so powerful that your enemies become your allies, and grow fast, become big, and then eliminate the competition. How, see how nicely these people have actually I mean, like they did not give competition to anyone, but they just bought them, isn't it?
Yes, ma'am. Yes, ma'am.
Yeah. So another true
And
story is that Barack Obama was the ice cream seller, Elon Musk was the worker in lumber mill. So moral is don't judge people based on their past jobs. Your present doesn't decide your future. Your courage and hard work does, isn't it? Elon Musk, you know, right? You all know, right?
yes, ma'am.
Yeah, okay.
Yes, ma'am.
Yeah, I
Please
do
tell me.
admire him a lot, but not his personality, but I do admire him a lot, like professionally.
Yes, ma'am. His ideas are like good. From innovativeness is good.
Sometimes it is crazy. You can't even believe that he like somebody.
Uh-huh.
Yeah,
Some are very crazy. Like people don't think of those also.
yeah. Think that he's planning to make a planet in Mars, planet in somewhere out of the what is that word? So that is what
Yes.
So something which is very difficult to understand, and sometimes it is unbelievable. Now his new project is that he is making the tunnels to, I mean, like reduce the traffic. So from the ground itself he's making the tunnels, and then planning a route inside the like in the ground itself, under the ground.
Yes, ma'am. Underground.
Yeah, but
I think he has like progressed also in that in some
yeah, yeah,
places.
yeah, yeah. But last time he had some nice interviews with I don't know which TV channel it was. It was a news channel, and they have, I mean, like he actually have taken the journalist into the ride, and the ride was really smooth, and it was so fast that it reached. I mean, like normally you takes that road for 30 minutes. He just completed within half of the time, so it is
Okay.
pretty cool. Yeah, and another story is that Colonel Sanders, the KFC owner, he opened the KFC at 65 when he was 65 years old. And Jack Ma, who was rejected by KFC, founded Alibaba. You know about Jack Ma, isn't it?
Yes, ma'am. Jack
Yeah,
Ma.
yeah. Though he's little bit crazy, but still he founded something. And then the moral of the story is that the age is just a number. You can be successful at any age. This I believe, okay, because I am still. I mean, like I have to figure out what I have to do. Let's see, like in the later age, what happens and when I'll become successful. And you also have to think about it. If it is not your time is gonna come anyway. Okay. So, and another thing is that never give up in life. Only those who never give up wins. Always remember that. Remember this all the time. And another story is that final one. Owner of Ferrari insulted a truck maker, tractor maker, and the tractor maker created Lamborghini. So the moral is never underestimate or disrespect anyone. Success is the best revenge. Yeah. Remember, they're like, for example, you think that you're being rude to your junior, especially it happens in MBA, but that junior can be your CEO someday. Got it? So never ever, I mean, like what to say, disrespect a person with their just because they are junior, or or they are under your level right now. You never know when that person is going to hit what. And like I have seen many of the time that our juniors, see, I am working over here in this institute. Though I know the designation is good, but then there are juniors of mine who got selected in Accenture and they really got good positions, right? So I mean, like you can say that I am somehow uh, inferior to them, isn't it? So that is like, you have to respect those people even if they are under your age. Now also I would say the same thing. I respect you, all of you. I don't know at what age you might become more successful than me, and you might acquire a better designation than what I am doing right now. So never ever disrespect any profession or any person who is inferior to you. Okay.
Yes, ma'am. Right, ma'am.
Yeah, so these are morals in the morning itself. We started with this. So you learn new things and don't what to say don't do stupid things in life. So we
Ma'am,
yeah yeah.
ma'am, some of the students are like trying to connect. I think they are giving message in the group.
Hmm.
Rahul and Silo.
Okay. Let's see. I am not getting any messages. Sometimes what I feel, these people switch off their net and then they try to, what to say, log in, and then they say that no, ma'am, it's not working. By the way, it's okay, I accept it, not a problem. Rahul and
Yes, ma'am.
Silo, okay, not a problem. Mm, but I'll stop giving attendance like this because I give attendance to all of you, whoever is giving even explanation that I was not able to log in or something like that. So I do consider them as well. But then I'll stop giving them now. It's okay, not a problem. If the reason is very much genuine, I should not be rude to them. It's okay. So we'll start with blood bank. Did you people study blood bank before?
Yes, ma'am.
So blood bank is supportive system, isn't it?
Um,
What do you think? It comes under supportive? Confused? Actually, it is supportive plus therapeutic because how therapeutic, because sometimes what uh, the person who is giving blood, I mean the donor also stays over there only, right? So you collect the blood from that person in the blood bank itself, isn't it? So you can call it as therapeutic and supportive both. It supports the therapeutic area and also some therapeutic what is that things also goes on in that particular department. So that is why you can consider both. Got it? Hello, can you hear my voice?
Yes, ma'am. Yes, ma'am. Yes, ma'am.
Yes,
Yeah.
ma'am. Yes.
Okay. So next, like I'll just talk about it. So it is a medical facility designed, equipped, and staffed to procure, draw, process, and store and distribute human blood and its derivatives. So what are the derivatives? You people know what are the derivatives? You people are not from medical line, but still you should know because many a times you get admitted and some of the derivatives are being administered to you people.
Ma'am, the components of blood.
Yeah. So how what are there? I mean, like what things are there?
MRBC, WBC, platelet,
Platelets, plasma.
plasma.
Yeah.
Yes, ma'am.
So
ma'am,
even albumin also.
Yes, ma'am.
serum.
Yeah, okay. So these are the derivatives, which I mean, like you collect the blood first, and then it's from the I mean, like for example, you think that uh, we don't need the red blood cells, right? So we only need plasma. So from the blood, we are going to only extract plasma, and that plasma will be what is that? Packed in a separated bag, and then it will be documented, and the labeling will be done, and then it will be dispatched. Okay. So blood bank is licensed by Food and Drug Association (FDA) and also by the local authority. Okay. So there is a lot of what to say debate going on that whether blood bank has to be licensed by Food and Drug Association or not, or they have to have different kind of license, but still it is being licensed by the FDA only. Okay. And for example, what is that? For example, is also member of Federation of Bombay Blood Banks. Okay, so Bombay Blood Bank से मेरे को कुछ याद आया. There are some rare blood groups, okay, which is very difficult to find out. I mean, you don't even get those kind of blood group people. So there are only few people those who have those kind of blood group. So what is the blood group actually? Tell me.
Ma'am, A, B, O, and AB.
Yeah. So there is a blood group called Bombay blood group. See it in Google once. Got it? All of you got it?
Yes, ma'am.
Yeah. So did you see that movie in what is that movie? Kahani. In that Kahani movie, there was one person who had, I mean, like where they have shown that Bombay blood group was found for that particular person, and so the thing is that these kind of blood groups are very much rare. So in case uh, the storing system is like this for this kind of people that whenever they fall in problem, or they got accident or something like that, nobody can give blood to them, right? So they only have to store their blood in particular hospitals, and then get what to say get transfused whenever it is needed. So that is the kind of protocol it is being followed for the rare blood group people. Okay. And also for this if any criminal activity is done by this kind of group people, no, it is very easy to identify. Tell why. Because you will be having the data for that particular person everywhere, so it is very difficult now, for very easy to find out those kind of rare, like people who has committed crime and has rare blood group. Okay. This is external knowledge which I have given you. Okay.
Yes, ma'am.
I remembered
Thank you,
it
ma'am.
with Bombay blood banks. Okay. So purpose of section. What is it? Almost all surgeries need BT. What is BT? Blood transfusion. Okay. So almost all the surgeries need blood transfusion. Accidental injuries, severe anemia, leukemia, and other cancers, and pregnancy related complication, bleeding disorder like thalassemia and hemophilia. Yeah. So what happens in, I mean, like those who are not from the medical background, I'll just try to explain the terms. Okay. So severe anemia means the person who is having really less blood count in their body. Okay. Less than 7, the HB is less than 7. So or I can say that less than 7 is still moderate. Some people used to have 5 or something like that. So for those people, it is called as severe anemia. Okay. And leukemia is a type of blood cancer, so which is very dangerous, which is really dangerous. You have to, I mean, for you have to change your blood all the time and purify it, and until and unless, like, however time you want to live, you have to do that process, you have to continue that. And pregnancy related complications, while pregnant, while a person is pregnant and the person is delivering, for example, you think that person is having pregnancy complications, and then during that time she has lost a lot of blood. At that point of time also, we have to keep ready the blood for that particular person. And bleeding disorders like thalassemia and hemophilia. So thalassemia and hemophilia is a kind of blood disease where the clotting factor is not good. For example, now say Naeem, if you cut your hand, after some time your blood is going to stop, right? Because you have clotting factor in your blood. But for hemophilia people, they don't. I mean, like once you have a cut, you don't like the blood doesn't stop. Seems to stop only. Whatever treatment or whatever prevention you do, it does not stop. So it is very difficult for those to people to like once they have cut, it is very difficult to stop the bleeding, right? So no substitute for blood, what is written. Blood bank required for timely intervention with ensured quality treatment. Yeah, so every time any quality changes has been done, or any accreditation, like like all the accreditation is having different kind of guidelines. The JCI will be having different kind of guidelines for blood banks inside the JCI hospital, and the NaBH will be having a little bit different kind of quality control measurements, right? So structural requirement will see, so where the blood bank actually has to be. It has to be in the ground floor, close to emergency department and OT, close to clinical services as well. Okay, so area of 100 square feet for its operation and 50 square feet for separation of blood components. Okay, by seeing this one, I remembered I might ask this in multiple choice question. Keep it a note. Keep this one in note.
Ma'am, which one?
The area of 100 square feet. This one. How much square feet is needed for operation, or 50 square feet for separation of blood components. Just remember this particular sentence for blood bank. And also Naeem, who was not there
Okay, ma'am.
yesterday, tell me, who else was not there yesterday? Naeem, you were not there. Nawaz, you were not there. Nivedita, you were there. Okay, so Amina, you were there yesterday in the second class.
Yes, ma'am.
I don't think you were there.
Ma'am, second class or first class?
Second. Yesterday only two classes was there, right? In the second class, I can
No,
see you were not there.
class.
Ma'am, me also not there.
Joydeep or Rahul? Rahul, right?
Rahul, ma'am. Yes, ma'am.
Joydeep was there yesterday.
Yes, ma'am, I was there, ma'am.
Yeah. Okay. So I have given some questions. Okay. Yesterday, questions in the sense, I told that these are the areas where I might ask questions. Okay. So I think Madhurja have noted it down. Take it from him. Okay. Or other people who have attended the class, they might know it. Okay.
Okay, okay, ma'am.
Yeah. All right. So next is that okay. So for also 2 mark questions, 4 mark question, you remember this, the structural requirement, the whole structural requirement for blood bank. Okay, is that okay?
Yes, ma'am.
Yes, ma'am.
Yeah. Also,
Yes, ma'am.
try to explain little bit what will be done in these particular areas. For example, donor requirement area means what they are going to do is they will be having one chair over there, particularly for donor, and then they will be what to say they will be what to say there will be a waiting area where the donor will be waiting, and then in the donor area, they will donate the blood for in the blood bank. Okay, and bleeding complex is the place where the what is that the what is that the blood is being stored, and once the blood is taken out from the donor and it is being stored there, and the therapeutic area where you extract those the derivatives I talked about, right? The plasma, and you have this what is that albumin and all, and then platelets, and the laboratories, you have also laboratory inside it, and administrative area as well, and storeroom and record room where you keep all the documentations. And department requirement is equipment routine, refrigerator, centrifuge, tabletop, water bath, incubators, microscope, pH meter, etc. So, what are the equipments needed? Is basically, you know, right? The refrigerator is very much important to store blood, isn't it? Did you people go to any blood bank yet? Did you people go to any
No,
blood
ma'am.
bank?
Yes, ma'am.
Yeah? Yes or no?
No, ma'am.
ओ अच्छा ठीक है कोई बात नहीं. I feel sad for you people. You people didn't see anything. So once you go inside a blood bank, you'll get to see the refrigerator. Okay, over there they also have. I mean, like in the refrigerator, they have all the equipments of the blood department. You'll be seeing some calibration. Calibration means every monthly they see that equipments are properly working or not. Whether there is a change. I mean, like something has to be changed.
Instrumental error.
Yeah, so and even in the refrigerator what temperature it has to be maintained, and whether the temperature is being maintained or not. So we do calibration, and then for that we have a documentation which we hang on the particular machine. Okay, so whenever we go along with you people go, right? So we'll be seeing those calibration, what they actually document in that particular calibration. Okay. So, in blood component, work equipments are freezer, plasma separation stand, and platelet agitator, etc. So these are for those, I mean, like derivatives. They have separation wala machine and agitator they will be having. So these are the therapeutic machines who extracts derivatives from the particular from the blood components. And screening of blood equipment. So, what is ELISA system with washer? ELISA is a kind of assay. Okay, so so these kind of assays. Uh, Screening of blood equipments. Okay, so for ELISA system with washer is also available in blood bank. Kits for HIV, HPV means hepatitis B and hepatitis C. VDRL is also a viral test. So all these kits are also available. Okay, while I mean, like when the blood is being drawn, you have to check all these things. You know that whenever for example you think whose blood is going to go to blood bank. Wait. Okay, so for example you think that Rahul has given blood, and now look, acha, nobody has donated blood yet. Anyone has donated the blood?
Yes, ma'am.
Who is that?
Same.
Enjoyed it.
Okay, Joydeep, what I mean, like you have to fill some documentation, isn't it?
Yes, ma'am. I have to fill some documents.
Yeah. So in that documents, what do you feel actually? What it is? I mean, like what they ask.
Ma'am, name, age, then any medication or any allergies.
Allergies and
All
all,
those type of.
right?
Yes, ma'am.
Yeah.
Yes, ma'am.
Okay, so you know, and once you give your blood, no, they also check for all these things. They check that whether you have HIV, hepatitis B, C, and VDRL. I mean, like any viral. This is a viral marker. So any viral diseases if you have or not. To identify that, they also check all these things. That's why they need the kids as well in the department. So water supply. So whenever I'm giving you examples, no, try to remember those examples, because whenever there is exams, you can just remember those examples and write accordingly, because these are just things which you'll just remember. Even like Joydeep went and he has filled some documentation, so you can write the documentation form, and this is needed in the process. You can just remember all those things and accumulately write something, because I told you people that I'm gonna give step marking as well. If you're trying to write something, then I'm not gonna give what to say. I'm not gonna like if it is right or not. I'll not see that. I'll see that whether the person has tried to attempt the question or not, whether that attempt is right or not. Okay, so try to remember all those things, then write the answer. So and also water supply. So water supply, pyrogen free and distilled. What is pyrogen free, by the way? You should, being a non-medical person, you people don't know, but you should know it. Because normally this is needed even for your home. What is pyrogen free? Now don't Google it. I'm gonna tell you anyway. You know about it?
Ma'am, I think it is related to pyretic. Pyretic is fever and all.
Yeah, yeah. So yeah. See, Naeem, you're not from medical, right? Still this guy know. Yeah. So this is the kind of substance which increases your fever. Okay. So there is a chance of that if you have this kind of water, your temperature of your body might increase. So that kind of substance. Okay. So like see, this water has to be purified. Otherwise, that also can actually increase your temperature. Okay, so it has to be pyrogen free and distilled one. So electricity supply round the clock, yes, because all the machines has to work even for 1 minute. If the refrigerator is not, because right, whenever the current goes off, after some time the refrigerator also used to get switched off, right? So in case the refrigerator is refrigerator is not having current, then the blood which is being stored over there will be getting wasted. That is the reason all the time, round the clock, electricity supply should be there. And sewage disposal system. Yeah, we talked about it. If we have to dispose those, what you're gonna dispose? You're gonna dispose blood, and you're gonna dispose, yeah, you're gonna dispose blood and other components, and as well as the consumables, right? So for that, you have to have a good disposable system, and the furnitures are also needed. Intercom system means. Intercom system means any communication communication system which is being used in that particular area. You can consider the phone as well. I mean the telephone. Okay, and mobile van. So mobile van also should be there. So we'll talk about structural design now. Okay, we have less time, isn't it? So, the walls shall be constructed using non-porous material and plastered both sides. This, wall finishing shall be washable. Antifungal paint should be there. Weatherproof paint, outdoor, and walls for cold room required special building material and design, so as to prevent condensation. Sorry. Floor, the floor shall be constructed of concrete and plastered smoothly, finished with non-slippery heavy duty material to withstand the heavy loads and traffic. See, you can write this anytime. Okay, all the hospital, whenever they ask of any structural design, what you can write in all the area of the hospital is that the concrete and plastered smoothly and finished and non-slippery. You can use that in any setup of the hospital design. I mean, if you talk about ICU also, if you talk about other department also, you can write this. Okay, and even this withstand the heavy traffic and load. Okay, because all the time you'll be like taking out the trolleys, taking out the heavy patients, and all the wheels will go all the time. So for that you can write this point all the time in any department. And the floor shall be non-porous, damp-proof, and resistant to detergent. So also this point resistant to detergent. Okay, this point also you can write for any other department. And floor ceiling height shall be ranging from 15 to 30 feet according to the functional area and handling equipment used. Okay, in the ceiling shall be made out with fire retardant. Okay, so this point also you can write in any other department, because all the ceiling has to be fire retardant. Okay, that means it should not, I mean, like अगर फायर है वहां पे तो वो कैच नहीं करना है, ठीक है. सो वैसा मटेरियल. So and asbestos free. Asbestos is a kind of dust, so that should not be there. And non-shedding material or mineral fibers. Okay, the ceiling shall offer acoustic balance and control for the room or space, preferably enhanced with sound absorption and attenuation. Space allocation. So there will be a receiving area where loading and unloading will be happening, and receiving counter also will be there. What is the receiving area actually? What is the receiving area? There will be an area where you'll be receiving all the kind of material into that particular department. That area is called as receiving area. That's why it is written loading and unloading will occur over there, and receiving counter will be there. Mechanical equipment parking area, sorting and unpacking area, transit and holding area, and disposable room will be there in this receiving area. And in the storage area, you'll be having general storage requirement, drugstore. Yeah, you also need a drugstore over there for any, like if any reaction occurs for the donor or any particular thing, you need a drugstore as well. And dangerous drugs, psychotropic substance store also has to be there. Cold room, pharmaceutical refrigerator, and freezer bay has to be there for the blood, and surgical store also has to be there. The stores with special storage requirement, inflammable store where you'll be keeping inflammable material. All the inflammable material means those who have the materials which is prone to get fire. Those materials will be stored in a different room. Corrosive items stores. Corrosive items are also a kind of material which is dangerous, so that also has to be kept in one particular store. And medical gas store, and for medical gas also there has to be one particular storage area. And non conformance and condemned item store. So this is for disposable. Condemned items are those which is being disposed. So that for that also you have to have a particular area. So issuing area is that area from where the department is going to come and take the particular derivatives or blood from the blood bank. For example, H2 may the nurse has sent the housekeeping boy saying that for this particular patient we need RBC, or we need RBC. So you will send the boy with the documentation, and the patient profile will be written over there, and all the identification. I mean, like whether the person, you have to write if the person's blood group, the person is allergic to something, or if the person what kind of diagnosis that person is having, and which under which consultant he is being looking after, and the identification of that particular patient. We have to write in particular documentation. You have to write in that particular document and send that document with the housekeeping personnel to the blood bank, and from the issue area he is gonna issue the blood and take to the particular department. Okay. And administrative area where all the paperworks are being done, so that area is called as administrative area. So ancillary areas are those which supports the particular department. For example, the cleaning room, the store room, and the what is that, dressing room for the employees. Those are called as ancillary area. Okay. So this is blood bank. You people have any doubt in this? I don't think you will be having doubt. Everything is understandable, isn't it?
Yes, ma'am.
Yeah.
Yes, ma'am.
Yeah. With this, I also want to inform you another thing. How do you actually transfuse the blood? What do you see? Like, for example, the nurse has sent the housekeeping boy to the blood bank, and the boy has carried the blood into a box. Okay, there is to be a freezer box. A small box is to be there where the ice is to be there, and you put the blood into it and then carry it to the particular department. So once after the blood is being issued to the department, now how the nurse is actually going to give the blood? How, what she does, how she's giving, because if you want to become a quality officer, then you have to know about it, because those things, like these are one of the particular area where the mistakes occurs. So that is why you have to know from before. If you want to work in a quality department, you have to know all these things from before. So how she is actually going to administer the blood to the person, can you tell me? Do you know people, and do you people know about it?
Don't know the process.
So anything you know about it, what, how she's going to give it?
I'm just like indenting, I think.
No, that is okay. It will be like indenting only. She'll be like filling out the details and send the boy to get it. But how she's gonna administer? Okay, fine. I mean, like I understand that it is a little bit confusing for you people. Once the blood is getting issued to the particular department, first what is going to happen, there will be a form which is being filled and checked by the duty doctor in that particular area. Okay, be it ward or be it ICU, wherever the blood goes, first it is being checked by the doctor. Just keep the process, like, write it down, so that you people, like, it is for your further professional career. So write it down. The doctor is going to first check the blood. Okay, and then what he's gonna check is, he's gonna check the identification of the particular person. And in blood bank, in the blood what is that pack, you'll be having one sticker, right? You have to check and match the sticker with the person's identity. Got it? You have one band in
Yes,
patient's
ma'am.
hand, right? Hospital made.
Yes, ma'am. Yes, ma'am.
Yeah.
Yes,
So
ma'am.
in that band, what it is written is, your the patient's name will be written, and patient's identification number will be written. So that is called as UHID number, right? So that particular number you have to match with that pack. Okay, the doctor is going to go to the person and ask what is your name, and he will be checking the name in the blood. What is that in the band, and also in the blood what is that pack, and match the numbers with it. So this one actually has to be there in the document only. I don't know why it is not there in the document, but this process you have to know. I have been, like, I also answered this question in my exam. They asked about it specifically. So he's gonna ask that person name and the identification number. He will be matching with the blood pack and the identification band. Okay. So once after it is done, the duty doctor has kept that form in the patient file. Now nursing supervisor will come. Nursing supervisor will come with the staff nurse who is going to administer the particular blood to the person. Now nursing personnel and the nursing supervisor and the staff is going to check it togetherly, so that any mistake doesn't occur. You know, right, what kind of reaction happens once the wrong blood is given to somebody, right? The patient might die then and there. Okay, so it is very important to check it twice, once by duty doctor, another time by the supervisor and the staff nurse at a time. Okay, and then once you are checking it, then the documentation is being done, and the staff nurse is going to what that administer the particular blood product to the person, to the patient. Otherwise, without that two particular check, never ever blood is being administered to the patient. It is very risky. Sometimes what happens, the number which is being written in the blood pack, uh, last everything is same. At last you have 6, but over there you have 7. Okay. Like first numbers are matching, and then the last number has not matched, but you didn't see because duty doctor was busy, so he didn't see. But in the when nursing supervisor is checking it, she might find out, right? So that is why double check is needed. Understood this process?
Yes, ma'am.
Yes, ma'am.
Yeah, so that is how blood administration procedure occurs. This you have to know. You have to know about it. You would be asked when your interview is given. Interview is taken by a hospital for a quality department. If you are going for a quality department, you'll have to know about it. Okay, so like double checking. Remember, always double checking is needed for this kind of particles. One is by duty doctor and by the nursing supervisor along with the staff nurse. Okay, is that okay?
Yes, ma'am.
Okay, all right.
Yes, ma'am.
हाँ नहीं नहीं ऑलमोस्ट होने वाला है. Yeah. So, guys, I think some more minutes are left. You can just have break for that time. I know it is not much, but still you can have break. All right.
Yes, ma'am.
Okay, ma'am.
Okay. So thank
Yes, ma'am.
you for the class and attending my class. And anyway, so in the like tomorrow, if I take class, no, everyone has to be present. I'm telling you. I'm not being I'm being lenient all the time to you people, but now I'm not going to be lenient. If you people are not coming for next week, I'm not going to give you attendance. All right?
Yes, ma'am.
Okay, ma'am.
Okay. Bye bye.
Thank you, ma'am.
Yes.
Thank you, ma'am.
Welcome.